Good afternoon. Welcome to our daily briefing on the COVID-19 pandemic. Thank you for joining us once again. This reflects our ongoing commitment to keep you informed and also our commitment to keep you safe, which is why we will once again repeat our public health message. I'm joined today by the Commissioner of Police, Ian McGrail. I will start with an update from A&E and with the latest test data as at 8:30 a.m. this morning. Remember that anyone with the symptoms of COVID-19 should call 111 first. In the last 24 hours, there were a total of 30 attendances at A&E. 11 of them had COVID symptoms. 8 were swabbed. 2 were admitted into the COVID ward and were awaiting review by the consultant. The latest test data is as follows. Total swabs 1,974. Results pending 50. Results received 1,924. Confirmed 132. Active 12. Recovered 120. All 12 active cases are at home. The grand total of 1,974 tests so far represents some 6.2% of the population. In terms of tests done per capita million, Gibraltar is now ranked 5th in the world. That is our data. But what about other small countries? How does Gibraltar compare with them, particularly those in Europe? San Marino, for example, has 461 confirmed cases. They also have, regrettably, had 39 deaths. Andorra has 717 confirmed cases and 36 deaths. There are 82 cases in Liechtenstein and 1 death. The Channel Islands data shows that Jersey has 245 confirmed cases and 12 have proved fatal, while in Guernsey, with 239 confirmed cases, 9 patients have sadly passed away. The Isle of Man has reported 297 cases and 4 deaths. So when we compare, when we look at the data, we see what is happening in Europe, we do have much to be thankful for. At the same time, we can be proud of the way we have prepared, proud of our public health staff, proud of our healthcare staff, of the public service and the emergency services, of everyone who has pulled together, and proud also of all of you, of the way you have risen to the occasion and faced the threats together. But we should not become complacent. We must not be lulled into a false sense of security, and it must not be driven by dangerous, misplaced bravado. Rash actions often carry serious consequences. Now is the time for serious thought and considered judgment. We have done well, that is true, but things can change very rapidly. The experience of other countries has shown that. The virus is still here. The virus is still highly infectious, and it has killed tens of thousands of people. Over 2 million infected cases worldwide. Over 20,000 have died in Spain, in France, and in Italy. Over 16,000 in the United Kingdom. The virus can spread quickly. It will move from person to person. So the less contact you have with others, the better for you, and also the better for them. As you know, the law allows you to go out in certain defined circumstances and for very specific purposes. So if you are going outside, then do so with care. Maintain social distancing. Stick to members of your household, the people you live with, and do not arrange to meet friends or to stop for a chat. And be careful. The Commissioner will expand on these issues. I would say something more now about social media. At a time of crisis, everyone wants to know what is happening. That is not unusual. The government understands that. That is why the degree of information we put before you is unprecedented. We recognize that these are truly exceptional times and that it is our duty to keep you informed, a duty that we take very seriously. This daily press briefing has become a focal point of reference for many of you. That is how it should be. Ministers will continue to update you. We will continue to answer your questions. Our medical and health professionals will do the same, and today the Commissioner. But listen to us and act on what we say. That is your duty, both legal and moral. Do not listen to self-appointed experts online. Sadly, there is an abundance of misinformation doing the rounds, as I said, particularly on social media. Here in Gibraltar and everywhere else, this is often based on half-truths, on rumour and speculation, on conjecture and on gossip, rather than on hard facts. What you need is clarity and not confusion. You need facts and not fiction. We give you these facts here, every day, at weekends and on bank holidays also. So do not allow yourself to be wound up unnecessarily by information you get from elsewhere. Listen to us. We continue to give you the cold facts every day. We set out the truth and we tell it as it is, both the good and the bad. So I repeat, get your information from us, from official sources. Do not waste your time with anything else. On another matter, I am pleased to report that the EU is set to allow the formal export of PPE equipment to Gibraltar. There had been an issue with this early on. PPE exports to countries outside the EU are restricted, as they protected the internal availability of supplies. Such goods are subject to a tighter export authorization regime under EU regulations published on the 14th of March. Gibraltar was considered a third country for the movement of such goods. This created a hiccup in the export process and put Gibraltar outside the standard export authorization regime. Consignments have nonetheless made their way through. This issue was identified, as I said, at an early stage and taken up by the United Kingdom at a high level in Brussels. The EU measure is being renewed this week, and we are told that it will be amended in order to provide for export to Gibraltar and also to some Eastern Balkan countries, and we are grateful for this. Some good news also in relation to those residents stranded abroad. The 2 who were in Australia have now returned home. This still leaves 51 persons in 5 countries: Dubai, India, Morocco, South Africa, and the United States. All have been advised to contact the relevant British High Commission or British Embassy. The largest group in Morocco has now grown to 39. The lockdown there was just extended recently until the 20th of May. Some of them have dual citizenship, and this has complicated matters further. But we continue to look for solutions, together with the Moroccan Community Association. The Cabinet met again this morning. A roadmap to release from lockdown was discussed. These discussions are happening all over Europe. The starting point for us is public health advice, and we are clear that this must be an orderly and a planned phased release, one which can be reversed at any time, and one which is dependent on a number of criteria, which were set out by the Chief Minister yesterday. Each step in the process will be followed by a pause in order to monitor the effects of relaxation. We will loosen, but understand that we may need to tighten again, for there is no proven path for release, and we are in uncharted waters, where every country faces different challenges. We do too. Gibraltar has avoided a surge so far. We have done well, but the surge may still come, and we must guard against this. For now, deliberations continue, and once complete, the plan will be made public. In that context, I want to say a word about the over 70s. Our advice there has not changed. To say, stay safe, stay at home. Simply put, if you do not go out, then you cannot catch it. If you do not meet anyone, then you cannot catch it. If you disinfect everything that enters your home, then you cannot catch it. The policy has worked, and our over 70s have been protected. But the law has always allowed our over 70s to go out for food shopping, to purchase medication, to walk a dog, to go to work, to go to the bank, among other activities. Our advice, nonetheless, has been not to do it, and we have set up a support infrastructure in order to assist the most vulnerable, to make their life at home more bearable. The Cabinet had a good discussion today. The decision was taken on public health advice to explore ways in which to allow the elderly to exercise outdoors at a defined location, at a specific time, on certain days, and in a sheltered or protected environment. The concept will be for a golden hour. That golden hour, the details of that golden hour, will be announced shortly. Such exercise, obviously, will be optional. Those who wish to can avail themselves of the opportunity. Many over 70s may well choose not to, but those who do must take great care. While they are at home, they're safe. Once they walk out of the door, there are risks. It is as simple as that. When the time comes, those who do exercise should stick to the household group. If you live alone, then walk alone. Maintain social distancing. You should not meet up with friends or family. This must not become an excuse to socialize. And as you make your way outdoors, be careful when touching things like lift buttons, door handles, and handrails, particularly if you walk down communal stairs. Do not sit anywhere. Exercise or walk and then leave. Do not touch your mouth, nose, or eyes at all, and wash your hands regularly, thoroughly when you return home. But remember this, there is good reason for confining the over 70s, and those reasons continue to be valid. They are the group most at risk. They are the most vulnerable group. Yes, anyone can contract COVID-19, but the cowardly virus preys on the elderly. They have been the worst affected sector of communities all over Europe, the hardest hit. That is the evidence from other countries. That is why our advice remains to stay indoors, even though the law already allows the over 70s to go out. We understand that confinement is painful. A lengthy confinement is even worse. You miss your family, you miss your friends, you miss a lifestyle that you were used to. We all do, but we live now in a different world where things will never be the same again, where we need to be more careful, and where uncertainty is now the new normal. If you are over 70, we know that Gibraltar has called upon you to make sacrifices in the past, during the wartime evacuation, during the closure of the border, and during those tough years of siege that followed. Many of you represent that generation, a strong and hardy people, who have faced every challenge head on, who have never shirked their responsibilities, and who have overcome one obstacle after another. Gibraltar calls for a further sacrifice now. Our world is uncertain. Our enemy, a killer virus. Our defense, staying indoors. So those who want lockdown relaxation have to follow the rules, in particular during the actual period of relaxation. The elderly will soon be able to exercise outdoors, but make no mistake about it. This activity will carry a risk. We can mitigate the risk, but we cannot eliminate it completely. The full details, as I said, of the golden hour will be announced shortly. And so, listen to our advice. Stay safe, and remember, at 8 p.m. every day, salute our healthcare staff and thank our essential and emergency services. Before passing on to the Commissioner, let me repeat our public health advice once again. Listen and act on the advice of our public health professionals. When you sneeze or cough, do so in a tissue and then bin it. Wash your hands regularly for at least 20 seconds. Do not visit anyone over 70. If you are over 70 or vulnerable, please stay at home. If you need medical advice, call 111. If you have any other question, call 200 418 18. And for emergencies, call 190 or 199 as usual. Stay home, stay alive. And I'll pass you on to Commissioner McGregor.
Thank you, DCM. Good afternoon, everyone. I'd like you to provide you all with an operational update of the policing efforts we have employed in response to the requirements of the coronavirus regulations. Since the commencement of lockdown measures, my officers, supported by GDP and Customs, have engaged with hundreds of people, the vast majority of whom have had a valid reason for being on our roads and out of their homes. I am very pleased with the way our officers are conducting themselves, working with what are probably one of the most complicated, if not the most complicated, pieces of legislation we have ever had to operate with. I sincerely thank them for that. I can tell you that the public's feedback is very much welcomed. These officers are applying an engaging approach, offering advice when challenging and warning persons who are believed to be breaching the law. So far, we have had 799 interventions for breaches of the regulations. Out of these, 30 have been arrests, but I must qualify that 22 of those arrests have been accompanied by other crimes in action, other criminal offences that the individuals have been committing. So there's only 8 arrests singularly attributed to COVID regulation breaches. The remaining 777 were dealt with in the street as follows. 2 were reported for process, 699 persons were warned or requested home, 68 were physically taken home. From the overall total, there were 197 over 70s. During our deployment, we get asked many questions by the public. Some are well intended, others are designed to test the regulations and our officers to the limits. Unfortunately, we don't have the answer to every single what-if scenario. We are policing by consent through extraordinary times, and the test for us all is that of reasonableness. So a key message I deliver today is that if you believe your actions are lawful and consistent with the stay home, save lives concept, and in consonance with the regulations, then you'll be ready to explain yourself if challenged by an officer. Now is not the time to become complacent like the DCM alludes to, simply because of the low numbers of the active cases of infected persons. It is more important now than ever that we abide by the rules and stick together as a community. It is evident that people are applying their own criteria to what can and cannot be done, and this causes confusion, and people tend to work each other up, particularly on social media platforms. In saying this, and because of the enormous efforts most of the public have put in, if there is anyone out there who is looking for loopholes and excuses to circumvent or ignore government regulations, then I'm sorry, but you're everything that is wrong in society. We are hopeful that these restrictions won't carry on for much longer, and it is indeed great to hear our government is already considering a process of unlocking these restrictions in a careful and thought out way. This is surely great news. However, it is the measured way of doing this and how you as a people respond to it that will dictate the success or otherwise of all our efforts. We owe it to ourselves. Having got to this stage, we should not be turning to complacency to run the risk of a surge of the virus. We have to trust our public health professionals. We have to continue pledging our trust in government that everything that is being done is absolutely necessary for everyone's well-being. As I said, it has been very challenging to police emergency regulations. I would appeal for the public's continued help towards any gradual undoing of the restrictions and support us along this journey. Let us not be preemptive and take the much wanted liberties of doing what we used to do pre-lockdown before we are actually allowed to do so. The best support for Public Health Gibraltar and the police is to remain compliant with the regulations as they stand, by staying home, only leaving for shopping of basic household necessities, for reasonable exercise, alone or with a member of your household, for any medical need, or to provide care for a vulnerable person, or when travelling to and from work. Much has been said about the over 70s population, who have had more restrictions placed on them than the rest of us. In my view, the most honourable thing to do is to show solidarity and respect for the incredible efforts they have made and continue to make. It can be certainly very disheartening for them and others who abide by the law to learn that some others are totally disregarding the regulations. It's so unfair on them. It is certainly time for all to be socially responsible and fair. Let me now turn to the most common of issues that my fellow officers are having to deal with on a daily basis relating to the COVID regulations policing. And please take good note if you do fall into any of these categories, because if you do, I appeal that you mend your ways. We are seeing friends pretending to be exercising when this activity should be carried out alone or with members of the same household. We are seeing groups of cyclists training together, defeating the purposes of social distancing and unnecessarily challenging the provisions of the regulations. We're seeing neighbours holding parties and barbecues in communal areas, boyfriends and girlfriends going in spins in cars, non-essential refurbishment works with groups of workmen within small commercial premises, gatherings of people, the type of which are not provided for in the regulations. We have also had to implement measures last week to control access to beaches and the Upper Rock after we saw too many people wanting to enjoy the good weather all at the same time, and therefore compromising good social distancing rules. We have also noted a surge in speeding vehicles, believe it or not. The roads are less busy, and some irresponsible motorists think it's the right time to race around as if they were in a circuit. Well, it's not the right time, it never is, and we are going to deal with these offending motorists robustly. With all that is going on, the last thing we want is for a serious road traffic collision or even a fatality to happen. Something which from the outset we are keeping a very close eye on in a multi-agency fashion is the question of domestic abuse. This after we've assessed the potential impact the restrictions could have on many households. Like we have previously reported, we are giving a sharper focus during these hard times of confinement. But we are pleased that we are actually not facing any abnormal number of cases since the lockdown commenced. We nonetheless strongly believe that there are individuals living in households who, due to the stringent measures in place, are suffering from emotional abuse or physical aggression and are simply unsure how to handle the matter, with many hoping that the problem will go away on its own. On few occasions it actually does, but on many occasions it does not. To these individuals I say this: there is help out there. No one deserves to live in an abusive relationship. I know it can be daunting to consider seeking help or reporting a case of domestic abuse, but during these testing times, government have made provisions for help to be readily available. There is no need to suffer in silence. With this message, I also want to reach out to neighbours, friends and relatives who may be aware of a person suffering from domestic abuse. Please call for help, and whether it is one agency or another, or even ourselves, the police, the matter will be dealt with tactfully and in a positive way. And with this, I end my address to you all. I close by appealing for the continuance of good community spirits and neighbourly relations. We can all turn this on its head. Think about this for 1 second. You are not stuck at home. You are safe at home. Thank you.
Thank you very much, Commissioner. Do we have any questions?
Thank you both. Our first questions today come from the Panorama. A Panorama reader has sent the following questions. Is it possible for employees who have been made inactive by their employers to seek additional temporary employment to supplement reduced income due to being made inactive? If it is not possible, what measures might the government have in mind to assist those who are unable to pay basic bills? such as private rent or utilities, due to having been prevented from working?
Because I understand that that person had a job somewhere, has now been declared an inactive employee and will receive the income accordingly if he is in a sector which is covered by this, and wants to know whether they can actually do another job in the meantime. My understanding is that it is possible to do something else. For example, if you are employed in a shop which is closed and you're inactive and you now want to sell pizzas, you can do that, but you would need to declare it.
Thank you, Deputy Chief Minister. A second question from Panorama. The public is being told that there is light at the end of the tunnel. Does the government know how long is the tunnel and what is the intensity of the light?
Well, both those are really the million-dollar question, and the reality is that if you look at the scientific advice which is going in Europe, public health advice, nobody knows how long this is going to last, and nobody knows what the intensity of the light will be. And what we do know is that there seems to be, if you look at the situation in China originally, where the pandemic originated, they are now coming out of it after a couple of months. It is possible that Europe will also come out of it after a couple of months, but I think the reality is that there is no certainty, and we don't know, because this is a new virus and we don't know how it's going to behave or react.
Thank you, Deputy Chief Minister. Our next question is for Commissioner McGrail, and it comes from your Gibraltar TV. Has the RGP noted a reduction in the number of reported crimes since the lockdown started? Which particular areas of criminal activity have seen the biggest reductions?
The period that we are looking at is only a very small period, so it would be not very accurate of me to say one way or the other whether there's been a marked increase or decrease in that respect. We would have to see for how long lockdown measures continue to give us a better picture. But suffice to say that in overall crime so far, we've noticed a 13% decrease, which doesn't seem to be too much, but then again, we're talking small amount of figures, crime figures in any case. So if we are to go further along the line and restrictions stay in place, I think we'd be better placed to answer that question later on.
Thank you, Commissioner. Our next question is for the Deputy Chief Minister, and it's from GBC News. For the sake of transparency, will the companies seeking Beat COVID payments be published? And if so, when is it expected that this will be done?
Well, I don't want to commit to anything, but these are issues which are being discussed in the CELAC group that was set up specifically to look at the Beat COVID measures. The group includes the Chief Minister, he chairs the group, the Minister for Digital Services, Albert Isola, and my colleague, the Minister for Business, Vijay Jainani. So they will make a determination, there will be a discussion within that group before any decision is taken to make anything public.
Thank you, DCM. Our next question is for the Commissioner, and it's from the Olive Press. Can you give the public some more information about the data collected on the profiling of social lockdown offenders, and if this is limited to a particular age group or lawbreakers generally?
I think in my statement, if I go back to it, I alluded to that we've had 799 interventions, of which 197 related to over 70. So I haven't got the further breakdown than that with me. But the issue is that the officers, we are recording those that are actually contravening the regulations. We are engaging with many people on a daily basis to establish. But if we wave them on, there's an indication that that individual is not breaching the regulations. We're taking particulars of those who are being warned, who are being escorted back to the residences, who are actually being asked back, and those who are being put through some form of process. Those fall into just under 800 in number.
Thank you, Commissioner. Our next question is from the Chronicle. It's an open question. You've both mentioned social media as a source of concern. Are you thinking of anything in particular, and can you give some examples?
Well, I think in my case, certainly, my concern is about misinformation which is being put out to people, and it can cause confusion, it can cause distress, it can make people's lives unnecessarily complicated. So our advice to people is always to get their official advice from the government. That is why we have a press conference every day at 4 o'clock. We give you the information, we give you the statistics, we let you know what is happening, whether in the Children's Health Centre, as I had to do last week, or wherever it may be. So we will give you both the good news and the bad news. And my message is that people should get their news from the government in relation to COVID-19.
And from my point of view, in addition to that, is that we are getting a lot of snippets seen in social media of perhaps areas that for some people the criteria to their liking is not appropriate, whilst other people feel that it is. And on many occasions picking up a particular time where there's more people out and about than others. That doesn't seem to be the effective part of the law, that doesn't seem to be captured, which should inspire confidence in people itself. But sometimes the irony behind it is there are people taking footage outside, complaining about people being outside whilst they themselves are outside themselves, so it's a bit ironic.
Thank you both. Our next question is also from the Chronicle, and it's for Dr. Garcia. On the EU measure you mentioned, can we assume that Spain supported the initiative to allow PPE exports to GIB without prior authorization? What can we read into this?
Well, if you remember, when the crisis first happened, and when there was a huge demand for PPE, not just in Europe, but indeed everywhere else in the world, countries naturally wanted to preserve the stocks that they had. We, in a sense, were quite lucky because we had done a considerable amount of stockpiling as a result of the possibility of leaving the European Union without a deal. So there was a huge amount of stockpiling which was done at that time, which was helpful. But the reality is that when it came to exporting either through the EU or from the EU, we found ourselves sadly with this problem because Gibraltar was not included and was not taken account of in that measure. So it meant we had to go through a more cumbersome and a more bureaucratic procedure. And although, as I did say in my address, that was alleviated, and because of our contacts with the Spanish authorities, we did manage to get PPE coming into Gibraltar. Now this will place that on a more formal footing.
Thank you, Dr. Garcia. Our next question is for the Commissioner of Police from GBC News. Do you consider it discriminatory to question drivers on the reasons for being out, but yet pedestrians who may not have reason to be out do so mostly without challenge? Will the RGP routinely question pedestrians too, in the same way as drivers are at roundabouts?
Pedestrians and drivers, we're dealing with people here, we don't distinguish. We have officers at strategic locations to try and be as effective as possible. Certainly there's no question of there being any discrimination in direction or steer from command to the officers in front line. And my information is that pedestrians are also being challenged. However, if you see somebody on a power walk, it is evident that they're on an exercise, whilst a person in a car may not be so straight away identifiable as to what his intentions are, his purpose is outside. So if that is deemed to be discriminatory, I apologize. I will certainly reinforce the fact that everybody is being treated equally.
Thank you, Commissioner. Our next question is for the Deputy Chief Minister. It's from Your Gibraltar TV. Since the Brexit referendum, Gibraltar has been keen to explore commercial and political links with the Commonwealth. Since the pandemic started, has the government had any contact with Commonwealth representatives or public health officials to exchange information and share knowledge?
Well, I would recall I was in London at the beginning of March when the pandemic had already happened, and where we had already had a first case of confirmed COVID-19 in Gibraltar. That included a round of meetings with Commonwealth organisations, including the Secretary General of the Commonwealth, where we discussed COVID-19. There has been ongoing contact since with countries in the Commonwealth, including, for example, the other overseas territories, and particularly where we've had cases of people who were stranded in this area. There were Canadians who landed here from a cruise ship, who made their way to the airport to board a flight to Heathrow, and also Australians also came in the same way. So we are maintaining the contact, but obviously the intensity of that contact is now reduced or confined only to COVID-19 issues.
Thank you, DCM. Our final question today is for you, and it comes from the Olive Press. Will the government be taking into consideration the decrease of social regulations in Spain in its planning for the relaxing of rules, or will Gibraltar act independently of its neighbour?
Well, as the Chief Minister has already said, and as we have made clear, and as we all know, this is not Spain, so obviously we are free to do things differently. But that does not mean we cannot take into account what happens next door, because I think indeed it is essential that we take into account what happens next door. So although we are free to implement our own strategy, our strategy takes into account the fact that there are in normal days 30,000 people could cross the border by land on any given day. That number is now down to less than 2,000, But as normality approaches, that is likely to increase. So it is obviously a factor which will weigh into the considerations as we try and move out of lockdown.
Thank you both. There's no further questions from the press today.
So thank you all very much. Let me just say before repeating our public health advice that tomorrow will be addressed by the Minister for Civil Contingencies, Samantha Sacramento, together with the Chief Secretary of the Government of Gibraltar, Darren Gregg. And just to remind you once more of our public health advice. Listen and act on the advice of our public health professionals. When you sneeze or cough, do so in a tissue and then bin it. Wash your hands regularly for at least 20 seconds. Do not visit anyone over 70. If you are over 70 or vulnerable, then please stay at home. If you need medical advice, call 111. If you have any other questions, call 200 41818. And for emergencies, call 190 or 199 as usual. Stay home, stay alive. Thank you.